Hi, well, good afternoon and welcome everybody. As is our tradition, I'm going to begin by acknowledging we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. On behalf of the board and team at Hamilton Health Sciences, I am so pleased to welcome the Honourable Christine Elliot, Deputy Premier and Minister of Health, as well as our own MPP, Donna Skelly, here today. We're so pleased to welcome you back to the Juravinski Hospital and Cancer Centre, and it's really great to see both of you again. Minister Elliot, it's a special honour to have you with us today. The pandemic has demanded a lot from everybody here in the province, especially those working in healthcare on the front lines. We appreciate the leadership and support you and your team have provided as we've collectively tried to respond to the twists and turns that the pandemic has thrown at us. I think in many ways hospitals have been at the epicenter of the pandemic, and that fact has really shone a bright light on the need for continued investment in healthcare, in facilities that are modern, designed to meet the highest standards of safety, and enable healthcare workers to provide the most exceptional experience possible for our patients and their families. Hamilton Health Sciences serves a large and fast-growing region of the province, and our vision is to provide the best care for all. That's why today's announcement is so important. Hamilton Health Sciences has a detailed plan, a plan that was designed in partnership with the government to keep pace with the needs and expectations of all of those who rely on us for care. We are gradually expanding our ability to provide the safest, most modern health care possible. So we are just so excited to be taking another step forward in this plan with the province today. Minister Elliot, I'm going to turn things over to you to share more with us.
Thank you very much, Rob, for your kind introduction, and good afternoon, everyone. It's great to be here in Hamilton today alongside my good friend and colleague, MPP Donna Skelly. Donna has been a strong advocate for families in Hamilton and for improving access to high-quality health care. I also want to thank the team at Hamilton Health Sciences for providing exceptional care to patients, especially over the past 2 years of the COVID-19 pandemic. During this unprecedented time, the Ontario's healthcare workers have gone above and beyond to keep our communities healthy and safe, and we'll never be able to thank them enough for their extraordinary efforts. Providing care to Ontarians throughout the pandemic was no small task. By working together, we quickly mobilized to face COVID-19. And our government made historic investments to protect our communities and to strengthen our healthcare system. This includes supporting over 3,100 additional hospital beds during the pandemic, including funding for over 130 beds at Hamilton Health Sciences. Our government also increased Hamilton Health Sciences operating funding for the third straight year, providing over $22.5 million in additional funding. And to help recover from financial pressures created and worsened by COVID-19, Hamilton Health Sciences received $17.2 million for 2020-2021 lost revenue to help provide financial stability and to support high-quality patient care. In addition, our government is providing an additional $827 million to hospitals across the province, representing a 4% increase from last year. This will ensure that all publicly funded hospitals receive a minimum 2% increase to their budgets to help them better meet patient needs while building a stronger, more resilient healthcare system. And I'm very pleased to announce today that our government is providing over $20 million in funding to modernize Hamilton Health Sciences, which will support the redevelopment of the Juravinski Hospital and Cancer Centre and the expansion of Hamilton General Hospital's Emergency Department. Building on the $3 million previously invested, an additional $5 million investment will help plan for the redevelopment of the Juravinski Hospital and improve access to healthcare services for the growing populations of Hamilton, West Niagara, and South Central Ontario. The redevelopment is planned to include a new patient tower that will significantly increase inpatient services and add over 100 new inpatient beds at the Juravinski site. Renovations to existing infrastructure are also planned to increase capacity for ambulatory care and support programs such as general and orthopedic surgery, adult oncology, intensive care and general medicine, and will ensure that patient care is provided in modern facilities. In addition, an investment of more than $15 million is planned to support a new project to expand the emergency department at the Hamilton General Hospital to help relieve space and volume pressures, provide additional space for ambulance offloads, and improve wait times for patients. From day one, our government made a commitment to end hallway healthcare and build a better connected healthcare system based on the needs of patients. Our government's significant ongoing investments in healthcare are helping to ensure that Ontario's incredible health workers have the resources they need to continue providing world-class care here in Hamilton and, of course, across the province. And by investing in the modernization of Hamilton Health Sciences, we are continuing to deliver on our government's commitment and enabling the hospital to better meet the needs of the communities that you serve. So thank you very much, and I would now like to welcome MPP Skelly to please say a few words.
Thank you, Minister, and good afternoon, everyone. I want to thank all of you for joining us here this afternoon for this very significant announcement. And of course, the money that we are talking about today will support the redevelopment of the Juravinski Hospital and Cancer Centre and the expansion of Hamilton General's Emergency Department. We all know that the population of Hamilton and surrounding area is growing rapidly, and I'm proud to say that our government is responding by delivering on our commitment to increase capacity and to address the needs of a growing region. The funding announced today will expand services and modernize facilities. It will add new inpatient beds at Juravinski Hospital and increase capacity for ambulatory care. The expansion of the ER at Hamilton General will relieve space and volume pressure and shorten the wait times for patients. It will also improve the ambulance offloading area. The catchment area for the specialized services and care at HHS is about 2.5 million people. To support the high-quality care that the staff at HHS deliver, our government increased operating funding for HHS for the third straight year. We are committed to making the necessary investments to quickly and effectively increase hospital capacity and to reduce wait times. And we are all committed to improving access to care. And now I would like to invite Dr. Sidhu to say a few words.
Sorry, I'm a little bit slow these days. But you know, this is wonderful news, and on behalf of my emergency department colleagues, I would like to express my gratitude to Minister Elliot and the Ontario government. A hospital's emergency department serves as the entry point to the healthcare system, and the Hamilton Health Sciences adult EDs are amongst the busiest in the province. The Hamilton General ED is also our region's trauma centre and cares for the most critically ill and injured patients in the surrounding area. The projects announced today are welcome news. They will result in larger EDs with better layout at both the General and the Juravinski hospitals. But most importantly, these projects are about an enhanced and improved patient experience. The renovated spaces will help to improve flow and will support triage and treatment spaces, but they will also have appropriate use spaces for increased number of bays as well as decontamination areas. As we build on the lessons that we've learned during the COVID pandemic, we know that we're going to need to have improved and increased safety for patients dealing with infectious illnesses and what may come in the upcoming years. Thank you very much.
Thanks, Kuldeep, and thanks, Minister and Donna, for such an important announcement. I feel, well, maybe a little bit of context. You know, redevelopment at the Juravinski Hospital and Cancer Centre really began back in 2006 with the completion of Phase 1 in 2011. You know, this year we lost Charles Juravinski, who, along with his wife Margaret, helped make this first phase of the rebuilding possible. And I know that both Charles and Margaret had hoped to see the site fully modernized, but I think Charlie is no doubt looking down on us, and I know Margaret continues to monitor this site very closely, and this is such a meaningful thing for both of them. So I wanted to pay my respects to them. Major projects like these require support from so many, including our team, various levels of government, and community donors. Already, there has been significant collaboration to advance these projects to this stage. I would again be remiss if I didn't point out our gratitude for the continued partnership we have with our foundation and countless other donors in the region, including Charles and Margaret, whose generous philanthropy continues to serve patients and inspire a new generation of donors. Before we finally wrap up, I just wanted to take a moment to recognize and thank Minister Elliot for her leadership as Deputy Premier and Health Minister during the past 4 years, and Minister also for your many years of service as an MPP and as Ontario's first patient ombudsman. Thank you for your vision and commitment to a more integrated and patient-centered healthcare system, and for your guidance through this extraordinarily challenging time over the past 2+ years. On behalf of our board and on behalf of the whole team here at Hamilton Health Sciences, Minister, we wish you the very best in whatever lies ahead for you. I also wanted to say thank you to our incredibly hardworking staff and leaders and physicians across Hamilton Health Sciences. These folks are so dedicated and have accomplished so much over the past 2+ years, and it's very much, today I think is very much a tribute to their hard work in making this growth possible. Today's announcement is a direct reflection of the excellence in patient care that they provide. It underscores this workforce's critical role in supporting the health and well-being of our community, region, and province. So together, it is our strong intention to honor that hard work by advancing these plans and building an even stronger healthcare system that enables a healthy future for all of the folks who we serve. Thank you all for being here today. It was nice to see everyone out, and I wish you a great rest of the day. And once again, Minister and Donna, we are very grateful. Thanks, everyone.
We'll now take questions from the media. If you can please line up behind me. Identify yourself with your media affiliation. It's one question and one follow-up only. Thank you.
Hi, Adam Atkinson, CHCH News. Can you do a breakdown of that $20 million again, please?
It's an additional $5 million is going to the Juravinski Centre to add to the $3 million that's already been given, for a total of $8 million for the plans that they are going to develop to build a new patient tower. The additional $15 million is for the emergency department rebuild at Hamilton General Hospital.
All right. Now, with the election coming up, some may question the timing of this announcement. Your thoughts on their questions?
I would say that this is something that we have made a commitment to for many years. Our government did commit to spending over $22 billion in the next 10 years for hospital infrastructure projects. And these are a long time in coming into being. It takes a long time from step one to putting the shovel in the ground. So this isn't something that just happened overnight. This has been worked on for a long period of time.
Minister Mark Allen with CBC News.
Hi.
Minister, you ran against Patrick Brown in the Progressive Conservative leadership race. What surprised you most about him?
Patrick? Patrick is a very, very hard worker and a very good campaigner.
Many people, news outlets, predicted you would win that race. You were leading in the polls, you had caucus support. In your opinion, how did Patrick Brown win?
He ended up getting more votes than I did. Pretty simple.
No other reason?
No,
I
it
didn't
was
see
pretty
that.
straightforward. Yes. Thank you.
Hi, Lisa Pileski from Global News Radio CHML. I guess this actually would be for Rob MacIsaac, if that's all right. I'm just wondering about if you could comment on the state of the Hamilton hospital system right now, how HHS is dealing with this stage of the pandemic, and the strain that may exist on the hospitals, and how funding like this will hopefully help alleviate that strain.
Sure. I think the hospital system in Hamilton continues to be pressured. I think as of this most current wave, the pressures are less about how many patients are showing up and being admitted because of COVID, and more about how many of our staff are having to self-isolate because they themselves are either contracting the disease or are at high risk for developing the disease. So we continue to be pressured, but we are, we're managing, and our surgical activity is up to 80% of pre-pandemic levels, which is something I'm proud of our team for having been able to accomplish despite many of the challenges that we're seeing with staff. What I think is important to take away from what this announcement means, so many of our facilities were built at a time when infection prevention and control was not top of mind, and so our infrastructure is not well designed to prevent infection happening within the hospital, to manage that infection well. By modernizing our facilities, I think it is going to be very significant in terms of our ability to deal with these kinds of situations, pandemics, infectious disease. So, I think that's something we can all be really pleased about. But also just the fact that we are going to see additional capacity being built into the hospital. I think a lot of our pressure beyond what I've already mentioned has been the fact that we've got a growing community, a community that's growing old at the same time. So we're seeing lots of increased pressure for our services, and having the added capacity both within our emergency departments, but also in the wards, because the emergency departments are only as effective as the capacity that backs them up in the rest of the hospital. So this is a very good news announcement for the City of Hamilton and for the surrounding region. We will be able to serve both our local community and the regional patients that we take care of much better.
Okay, and I don't know if you'll be the one to answer this follow-up. It is more related to the funding today. I'm just wondering when we might be able to see kind of these improvements start, and when is the work going to start being done? When will Hamiltonians and the surrounding regions be able to benefit from the expanded capacity? Yeah,
so I think if all goes well, we're looking at, I'm going to just confirm 2023 for a shovel in the ground, 2025 for completion. Am I right about that, Kelly? Sorry, I'm off by 2 years. Add 2 years to each of those, 2025 and 2027.
Okay, thank you.
Yeah.